Thank you so much, Dr. Ndlovu. I will give you an introduction about Dr. Ndlovu, but I would like Dr. Ndlovu to come in just to greet you and welcome you, because I can see more people are still joining in the webinar. So, Dr. Ndlovu, you may go ahead and just greet people and introduce them to this topic, because you are the expert in this topic that is being discussed today. You can go ahead. Please unmute your mic. I can see that your mic is muted. Thank you so much.
I would like to greet everyone who's part of this webinar and say welcome in this topic that is close to a lot of people's hearts. I know the breast and the heart physically are close to each other, but that's not what I'm saying. I'm just saying that just about anyone knows someone in their community or family who's been affected somehow by breast cancer. So it's a very important topic, and I'm looking forward to this presentation. I hope you are also looking forward to it. Thank you.
Before we can go ahead, can you tell us, a few people, can you just tell us what drew you to this webinar, and what are you hoping to gain from this webinar? Can few people, one or two people, just come in and tell us what interested you to come and join this webinar today? Can we have few hands? Okay, I see Sia. Sia has his hand up. You may go ahead, unmute your mic, and then you can go ahead. Thank you.
Hi, can everyone hear me? Am I audible?
Hear you.
I can hear you.
I'm allowed to put on my camera. It's not only the doctor's, I don't know, platform. Are we allowed? We have to be respectful.
Yes, you are allowed to turn on your camera.
Oh, okay. Because I don't know how to really interact with people when they can't see me. So let me just switch it on.
Yeah. I totally understand, Sia. You can turn
Can
on
everyone
your...
see me? Good morning.
Morning. Yes, we can see you.
Hi, my name is Sia. I am from Mpumalanga, but also in between Joburg. To answer what drew me to attend the webinar is because there's actually quite a lot of awareness about cancer, not even just breast cancer, but I think people don't actually take it seriously. People are aware that there is cancer, but like I was really drawn to this because I've been affected by experiencing someone in my family that had it, and I even recently lost that person. Like they were buried last week. But yeah, I've also met a few other people that have had it. I've had friends and family friends that have had it. So I do know and understand the impact from my point of view and also a friend's point of view in terms of how cancer can really affect one's well-being and the people around them, because it really takes a toll on people and even those around you. Because like once you find out, it's always something that we just hear, oh no, this person has cancer, until it's someone that's close to you. Then you realize that it's a real thing, you know. So yeah, that's why I'm drawn to come and attend this webinar, to also hear what other people have to say, but also just give my 2 cents, you know. So yeah, I think that's it for me for now. Yeah.
Thank you, Sia. Is there anyone else who would like to come in? I don't see any hand. All right, without any hands, okay, we'll just go straight to introducing the doctor. His profile is quite detailed based on the type of experience that he has and the type of work that he has done so far. Okay, so Dr. Sibusiso Ndlovu, he is recognized as the top family practitioner by the leading physicians of the world, with over 2 decades of experience dedicated to the holistic well-being of patients. Based in Pinetown, KwaZulu-Natal, Dr. Ndlovu specializes in family medicine with a deep focus on chronic disease, allergy, and occupational medicine. Beyond the practice, Dr. Ndlovu is a speaker committed to inspiring and educating others on topics ranging from health and wellness to marriage and entrepreneurship. Passionate about providing comprehensive healthcare, Dr. Ndlovu is equally devoted to empowering individuals and communities with transformative knowledge. Dr. Ndlovu has had the honor of sharing insights at various platforms, including the inaugural BJ Shabalala Mshengu of Ladysmith Black Mambazo Marathon at Nambiti and Elangeni College, Watabega campus. For 7 consecutive years, Dr. Ndlovu served as the resident doctor on the Friday breakfast show at Imbokodo FM, engaging a wide audience on critical health issues. Also, he is regarded as an expert in healthcare, and he usually do get invites from the media to come and engage with the audience on various issues that are involving healthcare. Through speaking engagements, Dr. Ndlovu strives to provide audiences with actionable insights, practical tools, and a renewed sense of purpose, whether in their health, personal lives, or business endeavors. All right, thank you, Dr. Sibusiso Ndlovu. You may carry on and engage with the audience. Thank you so much.
Thank you, Pume. Maybe before I go any further, I would like to just, I just forgot the name of the guy who spoke as to why he came or he joined the webinar. My brother also, sorry?
Yeah,
yes. Yes, my brother, I also lost in 2005. I even remember it was 30th of December. I lost my father to esophageal cancer. So when you say it affects the family, I know exactly what you're talking about. It's not just the person who's diagnosed. It's a heavy topic. When you know that your loved one has got cancer, it really knocks you down. You really have to raise. You need to rise and mentally be strong, and the family does get affected. So I feel you when you say that. Now let's go straight to the topic. In terms of looking at what the breast cancer, in terms of how common it is, the latest statistics show us that 1 in 30 women develop breast cancer. So you can see for yourself, in a group of 30 women, it's likely that one of them will have breast cancer. It's much more common in African women compared to other races, for reasons that we are not quite sure of. You go anywhere in the world, you look at women, the kind of cancers that they have, the breast cancer would be at the top. It's even more common. Some might think cervical cancer is more common. No, breast cancer is more common than cervical cancer. And it's also important to note that men do get breast cancer because men do have breasts, just that we don't have as much breast tissue and we don't produce milk. But the breast we do have, and some men do get breast cancer. It's another thing that sometimes men don't know. They think it's just women. We've noted that there's been an increase in diagnosis of cancer in younger women. One might say the awareness campaigns that we run, such as this one, might be the reason why people are picked up earlier, but also the fact that the disease is occurring at a much earlier age because of environmental exposures and some of the things that we'll talk about later on that put one at risk of developing the breast cancer. It's one of the reasons why that it's becoming more common now, even in younger women compared to, for instance, when I graduated in UCT Medical School in 2002, younger women, it's common at 50 years and above, but now it's at a relatively younger age than that. One might ask, why do I have to do breast cancer screening? Because the topic is about overcoming the fear. And we are trying to promote in whatever setting you are at, in whatever healthcare access point you find yourself in, could be public or private, it doesn't matter. We're just trying to get people to be aware and screen more early and more consistently. So if we screen, the benefit of screening for cancer is that we are in a position to detect cancer early before it becomes dangerous. And later we'll talk about stages of cancer. But if you detect it early, then you actually can survive it. I'm going to for instance, highlight someone that is very well known, Umamulinen Dube. She has said it in public, so I'm not disclosing anything. She's not my patient. It's not like I'm breaching any confidentiality. She said it multiple times on TV that she survived breast cancer. Why? Because she detected it early. It was about 15 to 20 years ago when she found out. She's still alive today. So cancer is not necessarily a killer. The issue is, do you pick it up early? And that is why we are encouraging the screening and not be afraid, because actually there are benefits in screening. So if you detect it earlier before any symptoms would appear, then you have a better chance. Obviously, also if people screen it regularly earlier and we detect the cancer early, deaths as a result of cancer will be reduced. There will be fewer people dying of breast cancer because we detect it early, where we can still do something effective about it. And also, if we detect it earlier, the forms of treatment that are used when it's still very early are not as aggressive as when it is beginning to spread. And the treatment, yes, it works, but it's a bit more aggressive if you detect it later on as opposed to earlier on. And of course, if you detect it early, there are a wide range of options of treatment that would work for the patient, as opposed to when it's later on and some options are no longer viable because it has spread to other places. So it's very important to understand that. And the screening, when should one start? It's one of the questions that people ask themselves. We can start. We encourage people to start at age of 25. When you start at age 25, from age 25 to age 39, we encourage people to screen it 1 to 3 years, depending what has been found. That's why there's a range. If there's nothing that has been found, nothing suspicious, then you do it 3 years or 2 years. But if there's something that was there, not a cancer, but a lump that's suspicious, then you repeat it almost on a daily basis just to monitor it. But once you reach 40 and upwards, then whether or not we find something, we encourage people to just do checkups every year. So we make it annual checkups. Now I'm one of those people who, when doing a presentation, I understand that medical topics are very technical. So I try to simplify it by describing or defining certain things. What is a cancer? Someone might be sitting here and say they know it. We talk about breast cancer, but really, what is cancer? What does it entail? Breast cancer is a cancer. I mean, cancer is a growth of cells that is abnormal in a sense that it's not regulated and it happens very fast. Normal cell growth is what we call mitosis. Mitosis is when a cell divides into two. So in our bodies, almost every 2 hours, a cell will divide itself into two. especially when you're still young and growing, that process is very much intact and works very well. So if you think about it, for your liver to maintain its size and keep growing, for your bones, for your whatever organ, every 2 hours, the number of cells must double. And that process is regulated and it happens in a way that is not going to overwhelm the body. But now, when it comes to cancer, you find that every 30 minutes, then the cells have divided into two when it has become. So you can see, it then explains why, for instance, people with cancer will have growth, whatever part that is called a cancer will have a lump or because the cells are growing at a much rapid pace. Two, why then the rest of the body you find them losing weight because these things are like scavengers. So they will just take all the food for themselves because they are growing at a very fast and unregulated pace. And that's why people lose weight because all the food is prioritized for these cells for them to keep growing. So you can already see why certain symptoms are in a particular way, just from what I'm telling you that normally every cell in the body divides into two in a process that takes about 1.5 hours to 2 hours. So this one is not regulated. You've got what you call pre-cancer stages. Before a cancer becomes a cancer, there are certain things that happen. One, you find that you get what you call hyperplasia. Hyperplasia is when then there's this rapid growth of cells, but the cells are still maintaining their shape. They still look exactly the way they should look for that organ or for that tissue. Then dysplasia, when things are going haywire now, it's really becoming a cancer. It's about to become a cancer. It's when it's the cell, for instance, if you look at the cell of the liver, if you were to put it under microscope and it's beginning to become a cancer or it's pre-cancer stage, it doesn't look like a normal cell now. It's changing its shape and everything. And then that is when you know that it's about to be a problem. So another important thing about a cancer is that um, cancers are named after the organ from which they originate. For instance, liver cancer is the cancer that originates from the liver. So even if it can spread to the lungs, once you find a cancer in the lungs and it has spread there, you don't call it a lung cancer. It's still liver cancer that has spread to the lungs. So that's what basically I'm trying to explain. Now, you might think, now we've spoken about how the cancer develops. Maybe let's look at what is the normal breast, the anatomy and physiology. I'm going to be very brief about it. Like I said, with males and females, we both have breasts, but females at puberty, there are two hormones that then stimulate the development of breasts so that they become feminine. And with females, you call them mammary glands because a gland is where something is being produced. So we know for females, the breasts are used for milk production. That's the main primary focus. I know there are other things, but the primary anatomical and physiological point of having breast as a female is that at some point you will fall pregnant and then it will produce and secrete milk. So it's called mammary. It's got a lot of mammary glands. That's why it's prominent in females. We don't have mammary glands. We don't breastfeed as males, so they are not as prominent. But you still have some breast tissue as men. That's why we said men and women get it, but with females, they've got prominent breast tissue. That's why they get it more. So the growth hormone and the estrogen hormone, those two hormones, they stimulate the growth of the breast tissue. Men do have growth hormone. That's why we say men also do have breast tissue, but women have estrogen. Men have very little estrogen, but females, that's their main two primary female hormones is estrogen and progesterone. But the estrogen hormone is the one that is mainly responsible for the growth of the breast tissue and its ability to produce and secrete milk. So later on, we'll see why the estrogen is important. But I just thought we should just mention how females develop their breasts. And then you've got what we call lymph nodes. Lymph nodes are just low pressure vessels that drain the tissue. I mean, we've got a lymphatic system. The lymphatic system is formed by lymphatic vessels, and then the lymphatic vessels drain to what we call lymph nodes. Lymph nodes are just glands that you find. Sometimes when you have an STI or a sore on your toe, or there's a sore on your knee, and then you find them on your groin, for instance. In Zulu, we call them izimbilaphu. So that's the thing, that's the gland. Those are lymph nodes. Some will have it on their necks because they've got TB or other conditions that cause that, or they've got sores on their head, and therefore they develop this. So those are lymph nodes. I'm just trying to explain them. So those are, when you talk about lymph nodes, those are things that drain the lymphatic fluid. They are also important. They play a role in the immune system. That's why when you have an infection, then they start to become bigger because they produce more immune cells that then will fight that infection. Now, with people who have got breast cancer, as we describe it later, you will see that it's one of the things that you see that are becoming bigger because then that's how the cancer will spread. Now, I think some people, some of you, if not most of you, have heard of stages of cancers. Because our topic is on breast cancer, we focus on breast cancer. So there are different stages. There's stage 0, where we call it carcinoma in situ. Stage 0, it hasn't spread, it just become cancer, but it's still localized within maybe a duct from which the milk comes, or just the breast tissue, just a focal point there. We call it carcinoma in situ. And that you may or may not have palpable. When I say palpable, to palpate means to use your hand to feel. When a doctor is using their hand to feel for a breast or to feel for some lump in your stomach, or we call that palpation. So when you palpate, you might find that the carcinoma in situ, you may not feel it. You may or may not feel it. And then that's stage 0. And then from we have stage 1 up all the way to stage 4. So the bigger the number, the more the cancer is spread, basically. That's the principle. If you're on stage 1, that's an early stage and still manageable. 2, it's becoming more aggressive. 3, it's spreading to other places, I mean, to the nodes. And then stage 4, that is when it's beginning to spread to other tissues as well, and other areas in the body, not just limited to the breast itself and the surrounding areas. Now, the common system that they are using, that we are using commonly, is taken from the American Society of Cancer. It's called the TNM system. Basically, what we look at is the information that we look at to make the staging. We look at the size of the tumor, and then we look at if it has spread to the lymph nodes that normally drain the breast tissue. And then 3, we look at if it has spread to distant sites. For instance, has it spread to the lungs? Has it gone to the bone and stuff like that? And then we look at what we call estrogen receptor status. Some of you might have read, because I know a lot of you are informed about this. When we talk about estrogen receptor, remember we said estrogen and progesterone are female hormones. So we look at the breast cancer and at the cancer cells and see if they still have the estrogen receptor, the cancer cells now. And remember we said the estrogen does promote the growth tissue, the growth of the breast tissue. So if the cancer still has the estrogen receptors, then it means the estrogen stimulates the growth, not just of the breast tissue, but of the breast cancer. And that has got some bearing in the risk. And then we also have progesterone receptor status. And then we check if the cancer cells do have the progesterone receptors. That also has a bearing in terms of the staging. And then we've got what you call an HER2 protein that is expressed or that is produced by the breast cancer cells. And the higher that protein is found, the higher the risk. And then now one might ask, what does it look like? Because of the of the pictures that we wanted to use, there are, what we call copyright issues that are involved. At the end, I think our host will direct you to. I've shown them what picture be very helpful in terms of looking. There are so many pictures in the internet, but I just chose the ones that they will allow you guys to have a look at, but they can't allow me to use it in my presentation. But the main thing is, how do you then at home suspect if you have a breast cancer? What could be the features that will make you want to say, hey, I think I might have it, let me go to the clinic, to the doctor, to the hospital? One, if you have a lump that is just persistently there and it's painful. That does not mean, by the way, that if you have a lump that is painful, therefore 100% guaranteed it's cancer. Remember, we're trying to encourage you to go and present yourself to the healthcare providers who will then do what they're supposed to do. But if you feel a lump in your breast, particularly that is painful, then you need to not take it for granted. It could be cancer. There are other things that also present as painful breast lump, like your breast abscess. When you have an abscess in your breast, it could give you that. That's why I'm saying it's not 100% once it's a lump and it's painful, therefore it's cancer. But you must go and have it checked. And then there's when you look at the skin of the breast, that looks like a peel of the orange. It's got those dimples that you see, quite a few of them, just like an orange peel. The term that is used is called pierre d'orange. Those who know French probably pronounce it better than me, but in medical circles we call it pierre d'orange. It just means, it's French for peel of the orange. Another sign to look for is when your nipple suddenly retracts. Nipple retraction is not a good sign. Your nipples should not retract, one or the other. It should just remain outside. Once it retracts, then that's a good sign that you must go and have it checked. Sometimes we have a nipple discharge. Could be just looks like dirty water, or it's pure blood. Sometimes it looks like it's pus. But especially if it looks like dirty water and blood, that is more likely to lean towards the side of the cancer. But you still have to have it checked, and doctor confirming that. You do get nipple discharge from mastitis, just a pure infection of the nipple. Sometimes you get it when you have a breast abscess. And then the other sign to look at is unequal breasts. If you were born like that, that's not a problem. I need to mention that up front. But if your breasts have been equal all along, and then suddenly, or over a short period, then you can notice that they are visibly unequal. That says go and have it checked. And then you can have what we call an ulcer. In Zulu, but it's slonda. Just an ulcer on your breast, anywhere in your breast area. It can be on the nipple. It can be on the skin around in the nipple. That we call areola. That skin around the nipple. We call it areola. If you've got a sore there or an ulcer, or anywhere in the breast, along the breast, and then you have a sore or an ulcer, then you need to have it checked. So those are the signs. Just to some, it's a painful lump. The skin that looks like a peel of an orange, a nipple retraction, nipple discharge, unequal breast, or a sore or an ulcer. Those are things to have a look at. If we look at the treatment now of the breast cancer, we remember we said we look at things like estrogen receptor. A receptor, by the way, is just something on the surface of the cell that whatever signal that is sent there or a protein attaches to effect a particular change. In this case, when you have, it means it's a protein, which is like a channel that is sitting on the cell that the hormone estrogen attaches to, so as to stimulate the growth of those cells and those tissues. That's basically what it is. So if it's found that you have these estrogen receptors still on the cancer cells, or the progesterone receptors, we call them estrogen receptor positive or progesterone receptor positive. That's how we classify the cancer. The things that determine, obviously, the treatment aside are those that I've just spoken about. And we also look if the cancer has had a certain, what we call mutation or change in the genes of the cells. That also influences the choice of the treatment that you give. Also, what determines what treatment we are going to give. I mean, people have got their own personal preferences. We are big on patient rights. Some people will say, I don't want my breast to be removed, and that's it. We have to respect that as doctors. So that also does influence the type of treatment. Also, your overall health. You know, if for instance you have a heart failure, taking you to theater might be more risky than giving you other forms of treatment. So those also influence it. And if you've gone through menopause or not, that also influences the choice of the treatment that we give, and how fast your cancer is growing. That also tells us what treatment we need to use. And then if it's affecting any major organs, has it gone to the lungs, and it's gone to the liver, that also tells us what treatment we need to use. And as a general principle, because I don't want to confuse you with too much detail, as a general principle, from stage 1 to stage 3, the options mainly are surgery. Remember, when we take you to theater to remove that cancer, stage 1 to stage 3, it means it has not spread to distant organs. So it's pointless to then take you to surgery, remove your breast, and then only to find that it's also in the liver, because it's also a cancer there, and it's still giving you problems. So when you are given the option of a surgery, it's because your staging is still between 1 and 3, and removing it will have benefits to you. Some might be sitting and say, but so and so of mine, they didn't widely remove the lump because it was there, but they refused to remove it. It probably had spread to bones or to brain or to lungs or to liver. So taking them to surgery was not going to help, because already it's gone to other places that you are not removing it from. And then stage 4, in most cases in stage 4, although I'll mention a few exceptions, in most cases in stage 4, we don't offer surgery except for a few circumstances, because it has spread to other places. So the options there are chemotherapy, hormone therapy. Remember, we said certain hormones are involved in the growth, so we manipulate those hormones. And what you call radiotherapy. In Zulu, most people, they say, yashiswa, that cancer, ishisiwe. So that's radiotherapy, where we use radiation. Remember, in stage 1, we can also, stage 1 to stage 3, we can also get surgery where we remove it and still offer chemotherapy, where we think there might have been some cancer cells that were left despite having removed the cancer itself. We can still get radiation where we burn, due to a lack of a better word, we burn the cancer cells, or the area around which it was cancerous, though it's been removed. Sometimes it's directed at the cancer itself. So that's the radiotherapy. So in stage 1 and stage 3, as we said, if you screen and it's either stage 1, we've got all these options to remove the cancer, to give chemotherapy to make sure whatever few cancer cells are surviving, we blast them, and we also burn them with radiotherapy. Sometimes you get offered all those 3 if you're in earlier stages. But in stage 4, it's mainly radiation and chemotherapy. Coming back to screening, the simplest way is to do what you call clinical breast examination. You can start at home. Just get used to the habit of looking in the mirror and see if your breasts are still equal. Remember, we said once they become unequal, then go and have them checked. And if you see all those things I talk about, if there's a discharge, if there's a sore or an ulcer, or if there is a lump that you felt as you were checking, or if you can see that there's a discharge, all those things, or the nipple is retracting as if it's going back into the breast, all those things. You need to look in the mirror and check them. In terms of palpating, by palpating, remember we said when you use your hand to feel for something, we call that palpation. So you can palpate your own breast. The easiest way to do, examine them both. You can do that every 3 to 6 months. Lay on your bed. If you're examining, for instance, the right breast, you take your right hand, you put it behind your head as you lay on the bed, and then you use the left hand to then start to feel using 2 to 3 fingers. Don't use your entire hand because you'll miss the smaller ones. So use 2 to 3 fingers as you lay on your bed to try and feel for any possible lump. And then you do the same with the opposite. Once you want to examine the left breast, you take your left hand, you put it behind your head, you lean on it, and then use your right hand to palpate the left breast. So that's you examining yourself at home. Obviously, as we said, depending on the age, we said if you are 25 years up to 39, once a year, you can even go and have your doctor examine you, or if you have a sister that is dedicated at the clinic to do that and they are trained and qualified to do that, they'll do it for you. The doctor can do it for you, whether it's in the clinic or in the private rooms of the doctor, it's fine. So breast examination is very important. And then the gold standard test that we do is mammography. You use mammogram. What is mammogram? It's a specialized type of an X-ray machine that looks into the breast tissue that can see. We're not going to bother you with what it looks like on the mammogram because that's not what you're going to have to interpret. But you just need to know that that's the test. You probably have heard it many times. It's mammogram, where the breast is put in an X-ray machine and then we take pictures that then assist us in determining whether you have what looks like a breast cancer. Once they find something in the mammogram, then you might have what you call fine needle aspiration, where a certain needle is going to be inserted and a few cells will be extracted for it, and then they are sent to the lab to be looked at under microscopy, then to see those things we were talking about, the dysplasia, and it's also useful for staging if then they found out if it's cancer. But just for diagnosis, you use the mammogram, and then if there's a need, then certain cells or a sample will be taken to the lab. Another thing that is used or test that is used is ultrasound. Ultrasound, people think ultrasound is only for pregnancy. No, we use it in the breast as well to see if there's any suspicious lump that then needs to be also examined and a sample taken to the lab for further examination. What is maybe I should emphasize at this stage is that the importance of mammography, in particular in ultrasound, they can detect a cancer 2 or 3 years before I, as a doctor, can actually feel the lump and actually be confident that this probably is a cancer. So we really are encouraging people to go and really try to have themselves checked, particularly with the ultrasound and the mammogram, what is important. Even if you're not on medical aid and you think maybe there's a delay or there's a backlog, in the public system, there are so many people and there's so few resources. Just invest in that. You just go to your family doctor and they will book you a mammogram. They'll tell you how much it is just once a year, especially if you know that you could be at risk. So that is what we call screening. And then the people who are at risk are those who started, who fall pregnant at an earlier age, those who are have a family history of cancer, those who are exposed to radiation. There are certain work areas that have got high radiation exposure, and people who work in X-ray departments, for instance, they are at risk. And obviously, the higher the age, the more you're at risk. And those who particularly abuse alcohol and those who smoke, those are also risk factors. I would like to stop at this point, and I will take any questions that you might have as an audience. I've reached a point where I think we can start to interact now.
Okay, thank you so much, Dr. Ndlovu. Wow, we've learned so much, and even the audience are saying this is an informative session. We have in the chat box, we have a message from Smashange. She says, thank you so much for such an informative webinar. My 5-year-old son was the one who noted that my right breast is bigger. 3 weeks later, my lump is removed.
Thank you.
Yes, thank you so much for joining this webinar. On the chat box, we have shared the social media links to follow Dr. S. Ndlovu Medical Center. You can follow it on Facebook and also on Instagram. You took your time, and some of you are joining from your workplace. So we really truly appreciate your presence in this webinar. We really appreciate it. And please do understand that if you have to rush somewhere, maybe you have a meeting, you can also be able to catch up on this webinar, because there will be a recording that will be posted on our YouTube channel, on Dr. S. Ndlovu Medical Center YouTube channel. So we will notify you once the recording is there. I can see a message from Duduzi Twala. He says, thank you so much for invitation to this informational and self-fulfilling webinar. Thank you, Duduzi. So we do understand that some of you have to join a meeting or do something after this webinar. We started late because attendees were still joining in from 9 until 9:15, so which is why we had to start late, so that we make sure when we start, most of the people who would like to gain from this webinar are already in this webinar. So, all right, after this webinar, we will send to you the survey that will really help us to improve in our webinars, to hosting the webinars. The survey will be very short. We obviously do appreciate your time. So the survey will be like 5 minutes duration to complete it. So I keep getting the messages here on the chat box. The other one is from Simon Gazi. Simon is saying, is there a stage where breast cancer has spread or grown such that there is nothing that can be done, or there is no cure or treatment? So I think that is directed to you, Dr. Ndlovu. And then there is another message from Kayeli Shlejari. Kayeli says, thank you so much, Dr. Ndlovu. This was a very informative session, much appreciated. So I think, Dr. Ndlovu, you may go ahead and answer the question by Simon Glazi.
Thank you very much for the question, Babundlas. Yes, there are instances where the cancer is so advanced that there's nothing really we can do. That's like almost the latest stage of stage 4. There's stage 4 and there's a later, even stage 4 is categorized itself. I didn't want to make it too detailed, otherwise just going to be information overload. But yes, you do get to a stage. That's why you have hospices where somebody has been in hospital and the doctors say, you know what, we're going to give you morphine. Morphine is just a drug for pain, just to numb the pain so you don't feel the pain. But we've reached the end. There's nothing we can do. We can't operate. We can't give you hormone therapy. We can't give you chemotherapy. Nothing is going to help. It does happen. But hopefully, for most, if not all, we reach a point where it doesn't get there, which is why it's important to go for screening. Yes, you do reach that stage.
thank you, Dr. Ndlovu, for your response. I can see Sia is also typing. Sia, are you able to unmute your mic? And then you can go ahead if you have a question, because I can say you are still typing here. Oh, I see the message is already there from Sia. Sia says, this webinar really gave me more information about the cancer as a whole, and I will use that information to spread awareness. I can see your hand is also up, Sia. Thank you for your message. You may go ahead because your hand is already up. You can unmute your mic.
Oh, okay. Am I audible?
Yes, yeah, we I can
Yes,
hear you.
Yes.
Obviously, from my side, I think it is very important to. I've obviously attended other, not only webinars, but I've also attended like events. You know, because there's usually events. I'd like to think the people that are in the medical field do try by all means to give awareness and teach people about these things. But only a few people do it, you know. And I would like to think also the best thing to do is also to chat to the younger people, because it seems like it's only the older people that are more frightened. Ngoba people think this thing only comes with age, like you mentioned. Like you said before, it's usually people that would be over, I think, 50 or 40 or something that would get it. But now it's more prominent in younger people, which I do know, because I do know a few people that I was studying with, uh, girls, a few girls, and then maybe a few guys that have had like some sort of cancer or a lump. I've even had a lump, but for me, it wasn't cancer. It was a lymph node. Yeah, I've got, but it was like across my chest. But I am one of those people that are very health conscious. So, like, I always check everything. I don't know if I'm just paranoid or I just always want to be healthy. So I'm like optimal in everything I do, you know, because like when your health is impaired, your mood is bad, your concentration, you're not happy. So yeah, I think it's just something that young people should be pushed to do, you know, because I think people only say, breast cancer awareness month, what, and then it's done, you know, and it shouldn't be like that because cancer is every day. For the rest of our lives, it will be there. And it's obviously one of the things that, like you said, should be detected early. Uh, yeah, it's a very vicious, I don't know, should we say, is cancer a disease? Can we label it as a disease, right?
It's called
Yes.
a dreaded disease.
Okay. Those are the labels that I need. So, yeah, it is a very vicious, dreaded disease. So, like you said, it should be caught on early, you know? Because I am one of those guys that are very vocal. I'm sure you can see I don't mind speaking, you know? So, whether I'm with my former classmates, people that I've worked with, I always make random things, you know? Random conversations about health. Even when people are drinking, like you said, drinking, smoking. I mean, even on the box, it does say this may cause, they give you the warning before you take all of those things. And people just take it out, smoke. And I'm always that friend that always asks, don't you think this is going to affect you in the long run? Yes, you may be considered boring. You know how it is. I'm sure you know, doctor.
Yeah.
Like people are like, oh no, Ash. But you guys also give this an awareness because you guys come across these people very often. And it's also very overwhelming. And I would like to think it's heartbreaking for you to have so many people and you can see that it's an overload, like and it's sad for you guys because I know you are using your time now to bring awareness because you're passionate about this, you know. So it really, I'm sure it really gets to you more than it would get to me, probably, because when you are in it deeply, so like you face people on and often, like more often in terms of these sicknesses and things like that. So I think also from my side as youth, we have to bring awareness. I would also like to ask, would you be open to having like lives whenever you're available for like a younger audience?
Yes, yes. No, we can do that. I think Pume can coordinate that because I work with her. She handles
Hmm.
that side of our work. So yes, we can do that.
Okay, yeah, okay. No, the reason why I'm asking also is because I have a friend that just started an NGO, right? But it's youth based. So every now and again we are going to need to have like events and things like that. But it's an NGO for young people that are like in sports, but it's not only guys. I'm in the rugby space, but there's obviously netball, hockey, or tennis and things like that. So there will be times where we need to give awareness and guidance to women, which I can obviously talk to Mpume about to be a part of that. Because we do really need that now, because I would like to think that the youth is, I don't know, they're off the rails now. They don't want to hear anything, you know. And at
Yeah,
the end, when something happens, they only realize when it's too late. It's just like the cancer, you
yeah,
know. Even with me, I hope I'm not dragging it, but I'm almost done. Um, my grandmother actually, like you said, if you detect it earlier, you can live longer. Like you said, there's someone that discovered it a while ago and it's 20 years and they've lived. So my grandmother found out that she had it 2012. That's quite some time back. But I
mm,
would like to think if she had said something earlier, she would have had like more time. It would have been jumped on to ASAP, you know? Because I think
mm,
even with old people, like old people just think, especially the ones that are not educated about cancer, they just like, it's just a lump.
yeah,
It's something that will just go on. And her friend actually alerted us. She didn't want to tell like my mother and her sisters. Her
mm,
friend directly came Ekaya, like where she stays, and told her that I know whenever we are doing this and that, she complains about something here. You know, she was just quiet and living her life. And I was like, what? I was like so shocked. So I think
mm.
we do really need to push the awareness about this, you know, because
Thank you.
yeah, it's rapid. But thank you for the information and sharing those necessary details about how to check and going for the scans every now and again. And yeah, we'll keep on pushing the message out and bringing awareness. Yeah,
Thank you very much.
yeah. Thank you.
Thank you so much, Sia. Thank you so much. So it's really eye-opening if we can hear someone also talking about their own experience when it comes to breast cancer. And you are right, the young people, they also do need to learn about the breast cancer because they are also at a risk of getting it. Even though as compared to the older, the more senior people who have a high risk, but also at a young age, the risk is there, especially if there is someone in your family who had the breast cancer. So yeah, so we will engage with you offline about being able to engage with the youth about this topic, this particular topic. And I would like to just highlight to everyone in this webinar why October is a breast cancer awareness month. What is the big deal about the breast cancer? Why there's this awareness and we're wearing all these pink? So it is a pink October because everyone around the world, we are trying to run this campaign that you must wear the pink ribbon. Even here at the Dr. Ndlovu Medical Center, we are all wearing pink ribbons in October just for the awareness purpose. It's because the breast cancer is the second most commonly diagnosed cancer globally. I'm not sure if you were aware of that, but yeah, that tells you how critical breast cancer is, and also it's a silent killer. Most of the people, they are not aware of it, which is why we have October as the breast cancer awareness, just to dedicate informing and educating people about breast cancer. I can see Ndlovu, his hand is up. You can unmute yourself. You can go ahead. Thank you.
Thanks, Me. Just a quick one from my side. Thanks, Doc, for your presentation. It was very informative. I'm going to be very short. Just two things, excuse me, I highlighted from your presentation, Yak, was in as much as I was visually aware that as a male I do have breasts, but I did not know I was exposed or there's some risk level that I'm in as a male as well to have breast cancer. I've always had this perception, which was mostly for abantu besifazane. That's number one. And then the other one you highlighted also was around things that would put one in high risk of having breast cancer. I think you highlighted, if when you've had pregnancy at an early stage. So based on those two things I've highlighted, I just wanted to maybe quickly check with you, Uguti, for abantu besilisa, what's the probability or what's the risk level roughly one as a male can have a breast cancer? That's number one on that topic. And then number two, for the early pregnancy, what ages are we looking at? If someone gets an early pregnancy, at what age do they expose themselves in having breast cancer in the future? Thanks.
Thanks for the question, Ko. It's a very important question. With males, the risk is somewhere between 1 in 150 to about 1 in 300. That's the risk. It's a bit lower. It's much lower than women, but it's still there. And then with regards to at what age, what do we mean by early pregnancy? Generally, we mean in teenage years, especially when you've just entered puberty, that puts you at risk. Teenage years, teenage pregnancy would then increase your risk of what we call cancer. What's the reason for that? The reason for that is what we call a wide estrogenic window. When you get pregnant, your estrogen levels rise a bit more to try and maintain certain things in your body as you are pregnant and even post pregnancy. So the higher the estrogen levels, remember we said some of the cancer cells we look at, if they have these receptors, are they stimulated to grow by the estrogen? So if you've got higher estrogen and you develop this cancer, or it pushes the growth such that it becomes higher, the risk becomes higher for you to develop cancer because of the high estrogen levels. So that's the thing that the pregnancy is associated with.
All right, thanks, Doc. Maybe just additional to that, also encouraging the point Garcia to say, I think this awareness really needs to get to like the youngsters as well, because I don't think most people are aware of that. And I think supporting a point that here, this message really need to spread to the youngsters as well. But I thanks, Doc. Appreciate it.
All right. Thank you.
Thank you so much, simply for just highlighting that point about the fact that also males can get the breast cancer. Thank you so much. And I can see an email from Relebohile Msomi. Relebohile says, thank you so much, Dr. Ndlovu, and thank you for the invite. I found the webinar very informative and enjoyable. Thank you so much for all these lovely messages that you are sending. And obviously, it does not end today. We will continue to engage with you after the webinar. You will get the link to participate in the survey so that we can improve in hosting such webinars. And also, if you would like to collaborate with Dr. Ndlovu Medical Center in your initiatives or projects around health and awareness, health and wellness. Also, you can engage with us after this webinar. Thank you so much. Dr. Ndlovu, is there anything you would like to say, just to say goodbye to the attendees?
I would like to thank them for their time. See, I know it can be a very inconvenient time. Some might have wanted to attend but couldn't. But thank you for their attention and the questions that they were asking. Thank you very much. I appreciate that.
All right, so thank you. This is the end of the webinar. Thank you for joining the webinar. Please engage with us on social media. Please engage with us also via email. You have the contact details. You will get them. We will send everything to you after the webinar. Thank you so much. May you have a lovely Wednesday going forward. Thank you so much. I see Kabisa Kwabe is also typing. Kabisa, if you are able to unmute yourself, because I can see you are typing in the message.
Thank you so much, Doc, for such an informative webinar. Thank you so much.
Okay. Thank you, Kabisa.
Thank you.
All right. Thank you. Oh, she was saying that in the chat box. She was saying thank you.
Thank
All
you.
right. Oh, that's the end of our webinar. We will talk soon.